Hi everybody, thank you so much for joining us. We are broadcasting live from Children's Outpatient Surgery Center out here in West Omaha. Today we're taking you behind the scenes in one of children's operating rooms. We'll look at the environment, the equipment, talk about how our surgery team prepares, how we prepare our patients. And our guide today is Dr. Shahab Abdessalam.
Hello.
Thank you for showing us around.
Yes.
Appreciate it. Yeah, and so he is a pediatric surgeon at Children's. He's also the medical director of our trauma program. So if you have any questions for Dr. Abdessalam as we walk and talk through about pediatric surgery, you can just type those in the space below and we will take them as they come. So beginning as you kick off, just give us a general overview of pediatric surgery at Children's. How many operations do you do in a year, and what's kind of the range of surgeries you do?
All right, so first and foremost, there are 5 pediatric surgeons in my group and at Children's Hospital. So those are the only pediatric surgeons in the entire state of Nebraska. So we really have a pretty focused program and a nice referral base in terms of no competition. It's really nowhere else for children to receive pediatric general surgery care. So that really makes Children's very special. In terms of how many cases and things like that, so my average is somewhere around 650 to 700 operative cases per year. So that averages 2 per day, roughly, if I were working every day. I don't work every day, fortunately. So my main OR days are Monday, Wednesday, Thursday, and Friday. So I'll typically have a day booked up that will occupy most of my day from pretty much 9 a.m. until whenever we get done. Amongst our group, we probably do somewhere about 3,000 cases per year. And
what's
so that's
the range? Like what kind of surgery?
Yeah, so then when you're talking pediatric surgery specifically, then one of the things that attracted me to it is you're really the kind of the true general surgeon for pediatric care. So I can operate in the head and neck region, I can operate in the chest, do thoracic cases. I don't do heart operations, we reserve those for our heart specialists. I don't do brain operations, we reserve those for our neurosurgeons. And bones, we reserve for our orthopedics. That means I operate in the chest, the belly, genitalia, buttocks, legs, extremities, so really the whole gamut in terms of the body that in range that I'm operating.
A big variety.
Big variety. And then the other thing about pediatric surgery that really separates it from a general surgeon and what they can do there are congenital diseases. So babies are born with abnormalities that need to be fixed as soon as they're born. So we're talking babies that can weigh less than a pound. The smallest baby I ever operated on was 300 grams, which is less than half of a pound. So the entire baby fit in my hand, and I had to operate on that baby. So we're talking really, really tiny instruments, tiny stuff. It's just specialized training that the average general surgeon wouldn't get.
And then on the other end, you're operating on teenagers.
And then, so then I can go from that case where I'm operating on a baby that weighs less than a pound to a normal teenage child who I'm taking off their gallbladder or appendix or operating in their chest, taking off lesions, anything like that, I'm sitting there laughing and joking with them, and they, they'll go home and eat a meal that was as large as that.
Yeah, yeah, so quite a variety. Now, safety is always first, so I thought it'd be cool to start with walking through the hand washing process. Okay. I think people have like a preconceived idea of what that looks like.
You see this on TV quite a bit, so where the surgeon is here and they're scrubbing, and so I will have already had my mask on, so nobody's going to put on my mask, but ordinarily I'd have a mask, and then I'm going to get my scrub brush, open it up, and so a typical scrub will last 3 to 5 minutes.
We're not going to do that today.
It's not that exciting to watch. So
5 minutes of scrubbing.
The key is that I'm trying to protect the ends of my hands, which are going to have the most contact with the patient, and letting the water drip backwards. And then these sponges are nicely enough loaded with soap. So I soap everything up. And in the process, and you want to get all the way up to your elbows, and then you'll never see me come back to my body. So then I start with my fingers, and typically, and I don't count this out, but 10 strokes everywhere. 10 strokes outside finger, 10 strokes inside finger. So you go through the whole thing, and then 10 strokes your whole hand, do the back of the hand, and then you do your hands first, and then kind of after the sponge would be the most dirty, then you do your arms, and then once that's complete, throw your sponge away again. So now my expectation is from my shoulders to my waist is where my arms can go.
Okay.
Anything outside of that field is considered
Above.
dirty.
Okay, so you got to keep them up.
So then I will rinse the soap off, and again, letting the water drip downward instead of backward. That would then contaminate my hands again.
Could you just do this in your sleep?
Yes, I mean, this is so natural, and you've done it so many thousands of times.
Right.
And so I'm standing here, and again, my elbows are out, I'm not touching anything, so my arms and hands are sterile.
You're ready to go.
Ready to go.
All right, so then what happens next?
So I will have already, the patient's going to be in the room. I will have already had anesthesia. They will already be asleep. We've already talked about the plan for the operation. And today we only have, a couple of people here, but typically in the OR room, there's going to be somewhere between 7 and 8 people. So it's a pretty crowded space, and as kind of the team leader, I need to make sure everybody knows what's going on with this patient in particular. Especially if you've got, 6, 8, 12 cases a day, you want to make sure that everybody's focused and on this patient, know the game plan for this patient.
Right.
So that's all been discussed. We do a timeout procedure before I even leave the room to make sure that the right patient, right site, right everything is happening for that patient. And it's actually a very formalized process if you want to take a look at what we do.
Yeah.
So here's our timeout board. So I physically read it, even though I can do this in my sleep and memorize it, I read every single step on this to make sure that nothing gets missed. You don't want to do something potentially harmful, and this is the safest way, and it's been demonstrated. And we always end with, if anyone sees anything unsafe or not in the best interest of the patient, I expect you to speak up and bring it to our attention. So that way, everybody needs to have that freedom. That's the part of being a part of a team, that everybody needs to have the freedom and have the confidence. And you don't want to be intimidating, so that's why I like to, my OR team I have relationships with. We talk about stuff. I know that they're comfortable with me, and I'm comfortable with them. Everybody in the room has to be able to speak up and say, wait, that's not right.
Right.
And that's the shared mentality of operating.
So really we do this, then we do the hand washing.
So then we go out and scrub. Patient's asleep now.
Yep. When you come back in, what happens with the gowning and gloves?
Yeah, so again, I haven't touched anything, so now I'm going to come up to my scrub nurse, and the way she hands the towels, she passes it with one hand, so I'm going to dry. I'm actually pretty dry already.
We've done a little air drying in this.
And then I go to the other side, and again, you'll notice my arms stay between my waist and my shoulders. And then I get rid of it, dry off any extra. She's going to gown me.
All right, I think I'm tying you.
Yes, you got to be the volunteer.
I am
for
not
that.
the A-team on this, but okay, great.
And one of our followers asked, how did we get so lucky to have someone of your skill level in Omaha? You want to talk about the skill level of our surgeons here?
All right, so to become a pediatric surgeon, so I went to undergraduate, and then I went to 4 years of medical school, and then I did 5 years of general surgery, and then I did a surgical oncology fellowship, which is specializing in cancer operations, and most of that was adult, so it wasn't pediatric specific, so that was 3 years. And then I wanted to be able to take care of really sick children, so I did a critical care fellowship, which was another year. And then I finally did pediatric surgery fellowship to really specialize and bring all of that together.
Wow.
So I was 11 years after medical school before I, quote, got a job. Fortunately, I had the patience of my wife and family through all of that. But so I was 11 years before I really got my first job. I was 38 years old. And so then when I'm looking for a job, pretty much I could go wherever I wanted. What was nice is, even though I'm originally from Ohio and didn't really know anything about Nebraska, I came here for my general surgery. And when I came here for my general surgery, loved Omaha. Loved the environment, loved the people, loved the simplicity of getting around.
Yes.
And I really liked Children's Hospital being right in the middle of it. It's an ideal circumstance. And then, so I left before Children's Hospital, the individual freestanding hospital, was even built.
Okay.
So I came here, interviewed, saw the new hospital. I was like, oh, it's a no-brainer.
Awesome.
I had great partners. You just want to set yourself up for success, and a lot of that has to do with your environment. And just really, really love Children's Hospital and what it could give me in terms of my practice. Huge draw area, again, no competition. It's just awesome.
Yeah, and we're going to talk a little bit later about kind of the future, what that next chapter holds.
Right, so at that point, there were only 2 pediatric surgeons here, so I was the 3rd one that joined.
Okay.
And now, as I said, we're up to 5, but yeah, it was a big move, and we're still continuing to grow.
Yeah, it's an exciting time. So we're in here, we're gowned and gloved. Kind of walk us around.
The dance, we
yeah.
call this.
Yeah, I'm like, what's this?
So that closes off my back.
Okay,
Even though I'm not going to reach around my back.
Okay.
Tie this up, and now I'm ready to operate.
All right, walk us through what we've got over here, some of your tools of the trade.
Yeah, so this is a typical kind of general set, I would describe. So you can see a whole lot of different instruments. A lot of these are very pediatric specific, but again, you'll find these even in the adult world. The most important, the cold hard steel of the surgical knife. So that's a typical pediatric surgical blade. In adults, we use a much bigger knife because they're bigger and fatter.
Okay, okay.
So that's a knife, and you can see it has a protective sleeve so nobody gets cut.
I guess it's smaller than I thought it would be.
The knife itself?
Yeah.
It just gives us a lot more flexibility in terms of the different sizes of children that we may be operating.
Okay.
Yeah, in adults, so this is a 15 blade. The adults typically use a 10 blade, which is actually a bigger knife.
Okay, and what about all of this?
So then we have retractors, depending upon how deep in the body cavity we may be or how superficial. These are all a variety of what we call pickups. So these, which have these round holes, are very specific for not damaging tissue. So I like to use this for holding the intestine. So it's not gonna, it can still hold it, but not crush it to the point that it's harming it.
Okay.
So then you have things for like skin, that's more specific for skin, and then these all are kind of dissecting instruments.
Okay.
So tools that we can use to divide blood vessels, separate different things. If I'm taking out a tumor or something, I'm using that to dissect. And then our other very, very important tool is right over here, the cautery. So if we don't have cautery, I don't know that we could do this.
You're in trouble. Okay.
Because cautery is heat. So heat is what will stop most of the small bleeding. So not vessels that you can name or visibly see, but you're going to have capillary beds. Everything's going to bleed, and this is what helps us to control bleeding.
Okay.
So it's electricity, and it generates heat. And if you've ever seen pictures that I've done from an operating room or a case, because I like to take pictures of things and give them to the families. A picture's worth 1,000 words is what I like to say. So they'll see little black spots in the picture, and that's the cautery or the heat that coagulates the blood vessels and keeps patients from bleeding to death. So we treat this kind of like a knife, and it has different settings depending upon if I want to coagulate or just cut. But that's what keeps hemostasis the best.
Okay, it looks like
You're getting a lot of love.
Yeah,
Oh,
a lot of gratitude. You know, that's what I think we find on these. People are just so grateful and know you and know their story on the other side of the screen. So glad to hear it. So that kind of leads me to a question. So you do so many surgeries. How do you mentally approach each patient? Because behind each patient there is a huge family who are treating it as the only surgery that matters to them for that whole year. So
well, and that's one of the things that kind of attracted me to pediatric surgery. So obviously I got tons of training, got to see a lot of different things, had a lot of interests, but really it was pediatric surgery that allowed me to fulfill kind of all my passions. Most importantly, I love the innocence of the child. That they, in general, didn't do whatever I'm trying to fix to themselves. versus an older adult that's may have abused their body, not with the best of stuff. So I love the innocence of the child. 2, it's really a special relationship that you form with a family. No matter if I'm doing something as simple as a hernia or if I'm taking out a big tumor out of somebody. The trust that a family gives to me to hand over their child and say, yes, take a knife to them. Huge responsibility on my part. And so I kind of really take each child and treat them as if they're my own. That's the kind of level I think you need to take it to really give it your best. So all those aspects, and then the gratitude that I get from the families every single day, over and over again, it really wants to make you do more and more. I mean, you get that constant verification of what you're doing is really, really good.
Yeah.
And I tell people I have the greatest job in the world.
Well, speaking of treating kids like your own,
Yes.
we have a special child here today that I'll let you introduce us to.
All right, this is my daughter, Zarina. She was kind enough to be my surgical victim today. We are not operating. I have assured her that we will not be operating today. So, but we're going to kind of demonstrate how we go through the prepping process. And this will obviously be after the patient's already asleep. So this is not something anybody would ever see or know is happening. So I think this is kind of a cool thing that we're doing here today to show that.
Thanks for helping your dad show us
So
some more.
Zarina, go ahead and lay back. So obviously I'm not going to touch her if she's not prepped, but I'm just going to kind of expose her tummy here.
Okay.
And then we use a special solution. It has a combination, it's called ChlorPrep. So it has a tint to it as well as antibiotic solution in there to kill bacteria on the skin. All of us have bacteria that's a part of our body and they help us, but in the operating room we want to try and destroy those. So basically what I do is, and I'm not generally the one that does it unless I'm being impatient, but so there's somebody in the room that is responsible. So I'm going to focus on, let's say I'm planning on doing an operation on her belly button. So I prep that area first, and then you do kind of concentric waves all the way around. And you want to give yourself enough of a field to operate, so you give yourself plenty of room, and you basically just let that sit, and it'll dry for 3 minutes. We won't need that anymore. And then once that's dry and that 3 minutes has elapsed, because this has an alcohol in it, and since we're using heat, again, to be on the safe side of things, we don't want fires in the OR. That's bad.
No, we don't.
So once it's dry, then I'm going to towel off my area. And this serves a couple of purposes. Primarily, it keeps the sterile field sterile.
Yeah.
So other places. Also mentally, I think it helps the whole team kind of focus on that.
Yeah.
Somewhat eliminating the human side of this, because it's bizarre to say, yeah, I'm going to cut on you. So you have to be able to detach yourself at the same time being attached. So it's a really weird relationship, and it's a complex thing. And I would say 90% of people would say, oh my God, you're crazy for even thinking about trying to cut somebody. But so yeah, it's bizarre.
It's focus. It's that balance. And
so then, to make sure that really the whole surgical field is sterile, we set this down. It's all done in a process. My assistant will be on the other side. We take this, and then this has stickies on it. We won't take the stickies off today. So we use this. Night night, Zarina.
You're a good sport, Zarina.
And then we have an upper drape, and then obviously we'll have 2 or 3 anesthesiologists up top. And you see how we pass these off. So we're always protecting. And now that this is done, and we won't suffocate her, so we'll let her breathe. So now the field is here. Everybody knows this is sterile. Nobody who's not in a gown and gloves will come up to the table. So there will be perhaps a resident, another nurse assist with the operation. We may have medical students in the room that are trying to learn this whole process. So it's a crowd and people get to watch. And the other kind of neat thing is, so we have cameras up here that I can focus right there on her tummy. And
All
then
right.
everybody else in the room don't have to be, face here, in here.
Exactly.
They can see the entire operation.
Very cool.
All right, scalpel.
And he's ready to go. So, well, this is very cool and definitely more than most people see. I have to ask you about kind of the future of surgery at Children's. We talked a little bit about what brought you here and what it was like when you first came here. Obviously, there's a big building being built at 84th and Dodge, the Hubbard Center for Children. Give us a sense of what the future of surgery looks like here at Children's.
So we are constantly growing. We know the demand's there, more of kind of regional, and I think everybody kind of hopes to be a national center for the care of children. So as that growth happens, we need to be able to accommodate. Right now, our hospital is full a lot of the time. It's hard to find OR spaces. Children's is really smart, and they built this outpatient surgical center. They said, hey, we can alleviate some of that stress at Children's with an outpatient surgical center. So out here on West Village Point, we now have 3 and potentially 4 extra OR rooms. So I'll come out here every couple of weeks, do a bunch of outpatient cases, but we're still full down there. There's not enough time in the day to try and squeeze everything in. So Children's knows that, administration knows that. They say, hey, we need a new building. So we're building the Hubbard Center. It's essentially going to double our OR capacity, and that's awesome.
How many total ORs will we have?
So right now we have, in terms of just main ORs where we can do any kind of case, 7 main ORs. So we're going to be at least doubling that to 14, 16 formal OR rooms. So that also plays off into other specialties, so they'll have more space. And then also, as we are taking care of more trauma cases, you have to be prepared in an instant that you may need to do an operation. So to be able to have a room just kind of sitting on the side waiting to take care of somebody is a huge value. So I'm really looking forward to it. 2021 seems really far away.
Yeah.
I want it built tomorrow. I understand there's a process. I wish it could happen as quickly as an operation happens, but I understand it's a process.
Yeah. In some ways it seems far off, and in some ways you'll blink and it'll be here. So very exciting times ahead. We really thank you for your time doing this today and your expertise. Thanks for doing what you do.
Yeah, no, it's behind the scenes and not something hopefully any of you people out there have to see.
This is your only experience.
But yeah, it's a cherished environment. I really enjoy the operating room. I really like being able to help children, and hopefully we'll have many, many more years to do it.
Yeah. Well, thank you again, and thank you guys as always for joining us. We enjoy doing it, and we hope you enjoy it as well. Please follow us, of course, on Facebook, but also on Instagram and Twitter, and you can always follow us at childrensomaha.org.